Hello and welcome to our Wednesday show. Coming up, one educator says that in this age of video, students don't think the way that they used to. And writer Lisa Birnbach understands kids these days, and she's going to be with us to talk about what they really want to know about colleges. Christina's mother gave her new ears for her 8th grade graduation, and Danielle's mom offered to pay for breast implants for her 14-year-old daughter. Now, it may sound crazy, but plastic surgery is becoming more and more common among teens. Is this an example of a sick society, so consumed with appearances that kids are going under the knife? Or is this an enlightened way of helping boost fragile teen egos? Dr. Sherrell Aston is Surgeon Director with the Manhattan Eye, Ear, and Throat Hospital. Dr. Michael Nicolai is the Medical Director of Cosmetic Care Plastic Surgery Specialists of Long Beach and Santa Ana, California. They're here to discuss this with us today. Dr. Aston, this is such a fragile time for teenagers when they see themselves through the eyes of others. Is there really anything wrong with improving upon the insecurities by allowing them to go under a surgical knife?
Well, certainly, I think you have to use very conservative judgment in selecting aesthetic surgical procedures for teenagers. Certain procedures, such as rhinoplasty, have been done for over 30 years, particularly in the Northeast. Some of the other procedures that are currently being done on teenagers in some places I wouldn't agree with. Breast augmentation, liposuction. I think teenagers aren't ready for these procedures psychologically and anatomically.
Dr. Nicolai, do you agree?
I somewhat agree. I don't agree with the breast augmentation in that a teen is fully developed usually by the time they're 18 to 21. If an 18-year-old is requesting augmentation mammoplasty, I think you have to individualize, analyze that patient, and it appears that they're psychologically ready for that surgical procedure and their expectations are realistic. I think you should offer it to them.
Let me ask a little bit about the youngest age that you would consider doing something, Dr. Aston. For example, we know that kids who have large ears may really suffer the results of that at very early ages, maybe even before they're in their teens. Would one ever consider doing a procedure before a teen?
Well, otoplasty, or correction of protruding ears, Sonia, is really the only procedure that is frequently recommended for teenagers or pre-teenagers. The ear is more than 90% developed when the child is roughly 6 or 7 years of age. And it is approximately that time that the friends, the peers at school, start calling them Dumbo ears, elephant ears, and that type of thing. So an otoplasty for someone younger than a teenager would be an appropriate operation in selected patients.
Dr. Nicolai, you are in what is often called the center of youth and beauty, and certainly a center in which parents might push young people into surgery in order to make them more marketable, either commercially or in terms of just being able to make themselves more competitive in marriage. Is that something you ever concern yourself with? That is the objective of the surgery, why it's being done, and who's behind it?
Absolutely. I think it's critical. When you do a consultation and a mother comes in and has a lot of negativeness about that child. Oh, my child has no self-esteem. My child is homely. None of the kids like my child. She's a problem child. She gets poor grades. Could you do a rhinoplasty on her? Or could you do liposuction on her? I think that would be a mistake. That individual has many seated problems that a psychologist or a psychiatrist may be able to help. Just doing a rhinoplasty might have that patient turn towards you and say it was your fault. That rhinoplasty was the root of all problems. So I think you have to take each individual and analyze them. Although California is a mecca for a lot of cosmetic surgery, I think we're Dr. Aston in New York, California, Paris. It's kind of all over the world today that more and more people, including teens, are requesting some type of surgical intervention.
Well, of course, the child is below age, and I don't know if you need the consent of the parent. It would seem to me you certainly would in order to be able to proceed with this, but it also could be that the child could change his or her mind. And let me just say, there was a time where I'm sure a woman like Barbara Streisand, it may have been suggested to her that she have a nose job. She resisted that, and there may have been people who came in and wanted Barbara Streisand's nose. The idea that there is one scheme of beauty distresses me. Different ethnic groups have different standards, I would hope, for beauty. Isn't there something wrong with us narrowing it down to one, Dr. Aston?
Well, I don't think, Sonia, that we actually really narrow it down to one. And I agree with you, different ethnic groups have certain characteristics that they see as attractive in their ethnic group. But there are certain characteristics, such as a large nose, that across the board, many people within ethnic groups like to have changed to a more attractive profile. And I think this is an acceptable procedure to help teenagers feel better about themselves.
Look, let me just use that and jump off of that. Dr. Nicola, we understand that a number of young Asian females, and maybe males too, are asking to change the shape of the eye. The almond eye has been a source of great beauty, but it is not a Western eye. Do you think that is a reflection of a lack of acceptance when someone from a group like this asks to change in such a fundamental way?
I think you can get both walks. There are some individuals that come in, some Asian patients that want to increase what's called the fold, the upper fold of the eyelid from the lash to the first crease. In an Asian, they're anatomically different than the Westernized eye, and you're trying to create a small 2 to 3 to 4 millimeter fold there, enabling them to put a little makeup there. Now, there are some individuals that come into our office, Asians, that want truly to look like a Western individual. And that's quite difficult. I think you have to analyze that patient as you do each individual
Dr.
patient.
Nicola, let me present you with a hypothetical 16-year-old female and tell me what you wouldn't do to her, even though her parent might give permission.
I'm sorry, could you repeat
Tell
that?
me what you would not do.
What I would not do?
Yeah.
I read a recent article in the Wall Street that said that somebody was doing facelifts on teenagers. I mean, I think that's absurd. I've never done in 10 years, doing over 1,000 cases a year, I've never done a facelift on a teenager electively for cosmetic. Dr. Aston does a lot of craniofacial, and in his practice, that would probably be an appropriate procedure. But not in my practice.
I would think only for reconstruction, just as I know in my reputation, which I happen to. So I would think that would never occur unless there was a double accident and you were doing that kind of reconstructive surgery, correct?
Sonia, I would never perform a facelift on a 20-year-old or a 16-year-old. It's not an appropriate procedure at that age.
Let's do this. I would like to ask the parents out there, maybe some who would be open enough to admit that they have considered this of their children or that they have gone ahead with this. Under what circumstances would you do it? And perhaps if you're considering it now, why? 212-714-7810, join me. We are talking about plastic surgery for teens. Dr. Sherrell Aston is the surgeon director at the Manhattan Eye, Ear, and Throat Hospital. Dr. Michael Nicola is the medical director of cosmetic hair plastic surgery specialist of Long Beach and Santa Ana, California. Dr. Aston, before we continue, this is a competitive field. There may have been one time where there were not a lot of plastic surgeons. There